With regards to dental fillings, there are various options to patients. Each filling type has specific advantages and disadvantages. It's crucial to comprehend the difference of each to be able to make an informed choice regarding which option is best for you. In this clip, we'll have a close examine the different kinds of dental fillings. We'll also look at the benefits and drawbacks of every. 1. Amalgam fillings. Amalgam fillings, also referred to as silver fillings, have been utilized in dentistry for nearly 150 years. They're an amalgam of mercury, silver, copper, and tin and are well known for their strength and durability. They are an option to fill front teeth as they have their chewing force the most effective. One disadvantage of amalgam fillings are their silver hue, which could appear unattractive and is problematic for patients who want alternatives that look more natural. 2. Composite fillings. Composite fillings consist of the combination of glass and plastic videos. They're designed to be matched with the shade of your natural teeth. They're an option for patients looking for an attractive choice because they seamlessly blend into other teeth. The composite fillings can also be used for a variety of purposes and can be utilized for repairing tooth that has been broken or damaged. They do not last as long as amalgam fillings and could have to be replaced regularly. 3. Ceramic fillings. Ceramic fillings, also referred to as porcelain fillings, are created out of a tooth-colored material that's durable as well as pleasing to the eye. These fillings are an excellent choice for those suffering from an allergic reaction to metal or concerned about the risk to their health from mercury in amalgam fillings. Ceramic fillings are also highly resistant to staining and recognized for their durability. Ceramic fillings may be more costly over other kinds of fillings. They may also require several appointments to the dentist before they can be put and installed. 4. Glass ionomer fillings. Glass ionomer fillings consist out of a mix of acrylic and glass. They have the ability to release fluoride that will help to strengthen the tooth structure. They're often employed to fill cavity among children because they may help stop further decay and also protect the teeth from damage in the future. The glass ionomer fillings are more insensitive to changes in temperature in comparison to other kinds of fillings. They are, however, less durable and strong than other fillings and might have to be replaced regularly. 5. Gold fillings. The gold fillings are also referred as inlays or onlays, comprise a blend of different metals, including gold. They are well known for their durability and strength. They're an excellent choice to patients searching for a tooth filling that stands through the rigors of the test of time. They are also biocompatible. That means they're well tolerated by your body and less likely to trigger allergic reactions. They are, however, costlier than the other types of fillings. They may also not be suitable for those worried about the aesthetics of their teeth. There are various types of dental fillings for people, each having its own benefits and drawbacks. When selecting a dental filling, it is important to take into account things like quality, aesthetics, and health-related risks. Your dentist will be able to help to determine what type of filling is best for you based upon your personal preferences and requirements. When you understand the differentiators among the different kinds of fillings available, you will be able to make a well-informed decision regarding your dental health and ensure an attractive smile for the decades to come.